going on? All right, today we're talking about midline stability and more so low back pain. So if you have low back pain, good chance it's not just your low back and it's not just a lack of core exercises, it's everything around this area that controls the lumbopelvic hip complex. So big fancy string of words that basically means the area between here and the bottom of your butt. So we have to take care of that, kind of line that all up, make sure it stays in what's called a neutral position. So your body tries to maintain the pelvis like this, and I've said this before, think of your pelvis as a bucket and it's filled to the brim with water, and as you move around, your body's doing everything it can to keep that bucket from sloshing anything out. What ends up happening when you get severe low back pain is that bucket gets tilted towards one side or the other, or rotated back and forth, or even around the axis this way. All of those combined turn into this hot nightmare because there's 19 muscles on either side of the hip, plus all the abdominals in the front and all the paraspinals in the back, plus all these little intrinsics, even the transverse abdominals here has something to do with it. So I'll show you exactly how to take care of that. First thing we want to do is we want to work on actually engaging both the front and the back. If people are telling you that it's just a lack of core strength and abdominal strength, they're wrong. That's not the truth. It's the entire system. So first things first, we're going to do what's called a banded cat-cow. So we grab any band is fine. This is a lighter band just because I'm going to make it a little easier on myself, because if you saw it today, I did Kelly, and Kelly is an incredibly shitty workout. So what we do is the band is around my low back, and I'm holding it in my hands right here. So I can see that the camera, I'll come over this way, camera's not picking it up. So there we go. You can see my hands, and I'm going to be in quadruped, and now I'm just going to arch and then push out against the band. This is just general range of motion. Really push hard. Let the band pull. So what you're doing is you're retraining your body to recognize lumbar extension and flexion. So really push into that and really come into extension. That's number one. Number two, this one's fun, is you're gonna get a kettlebell. Sure as hell I'm not using that 70. So we're gonna use this kettlebell. This is just a 15, nothing heavy. We're gonna do kettlebell hollows, okay? So you take the kettlebell, hold it like this, get into a hollow position, okay? I'm holding the kettlebell, my low back is pressed into the floor, and then all the way back, whoa, and then all the way back up. And just do this, 3 sets of 15. Yeah, I know that sounds awful. And then when you're done, don't drop the kettlebell on your face. That's number two. Number three is a banded knee flare. So you've seen this before when we've talked about the glute med and knee problems. Well, this all ties into the low back. So you take the band, double it up. So the band is doubled up. If you notice, it's above the knee joint. We don't want a fulcrum on that knee because it's going to cause a lot of problems on that MCL if you're loading below the knee. So we go a little bit wide. Again, I'll come over here so you can see where my feet are. We're going to get down like this. I'm going to go a little bit wider with my feet than my knees. I'm going to bridge out, and then I'm going to flare, and then come to neutral, keeping that band loaded. Flare and neutral while I'm squeezing my glutes and my midline. And I'm just going to go through nice, slow, oh, it's miserable, ranges of motion. That is number three. Number four is a side plank with a drop, and there's a difference. So we get in our side plank position. So side plank, all the way up, arm up. So I'm actively pressing out with my shoulder. I'm going to touch my hip, keep the arm up, and then come back up. Touch my hip, come back up. So I'm working, actively working the midline. The byproduct is I'm actually working my shoulder too. So that's it. You want to fix some of that low back pain, go through those 4 drills. Hey, listen, I'm Travis, SmashweRx on a Tuesday. I'll check you guys out tomorrow. Have a great day.